So, what are your suicidal thoughts trying to tell you? When you are thinking about ending your own life, that thought process, that way of thinking tells us something. It says that we are trying to escape. We are trying to escape the pain. But everything, especially when we're feeling that sad, that alone, that detached, right? The negativity just floods in. So it's so hard to piece through and peel back the layers of what is happening to us and trying to understand what these suicidal thoughts actually mean. Unconsciously, what do they mean? For instance, individuals who struggle with more passing thoughts are experiencing this because they're not acting in line in accordance with who they genuinely are, or they feel as though that their situation doesn't match what their ideal situation should look like. So there's this tremendous need to escape. But the problem here is that people typically continue doing the exact same thing. Their behavior doesn't change, yet they hope for something different to happen. That's a problem. Because unless you change your behavior, the result is not going to change. So by identifying what is contributing to the stress, to the trauma, to the suicidal ideation, then we can start to process what we can do to not just avoid that, but what we can do to process the pain and place ourselves in a situation where we can grow. So for instance, if you're in a romantic relationship with someone who is struggling with their mental health, and this might be someone who is completely in denial of their struggle and someone who does not want to reach out for help or wants to reach out for help but never actually acts in accordance with that and doesn't actually reach out for help, then you're stuck in the negativity with them and you're absorbing that negativity. So you might not experience depression. Your partner might experience depression. But just because you're in close proximity and you're spending time with this person, you begin to internalize what is happening. So they unconsciously project onto you and you internalize that crap. Now that's a problem because now you want to escape that. So instead of thinking about what has happened to you, what is contributing to these intrusive thoughts, you start to think about what is a plan to escape. Do I have a plan to end my own life? Do I have a plan to break up with this person? What do I do? But people, unfortunately, on a typical basis, continue doing the exact same thing they were doing before, expecting something different to happen, a different result. And that just doesn't work out. Diving into the depths of your mind, understanding what is contributing again to that pain, understanding it and creating boundaries, having a conversation with the person who is essentially infecting you will allow for you to better understand that you don't want to end your own life. You want to escape the pain. You want to escape the dynamic with this person. So that might not even necessarily mean ending the relationship with this person, but coming together in partnership in such a way as to support one another, to have each other's backs. So maybe you're going to be actively encouraging this person to go seek therapy. And if this person not only respects themselves and respects the relationship and wants growth, but this person just doesn't want to feel this way anymore and wants to live a life on their own terms, then they're going to do something about it. Both of you can certainly enroll in the Ultimate Mental Health Toolbox, Mastering the Skills Therapists Use, and this will help you both to uncover what is triggering you, what is driving that negativity, and what that negativity is actually saying. Because more often than not, and this is supported by research, people don't want to actually end their own life. They just want something different. They want relief.